Today we're going to talk about route slips in a chartless practice. You have to watch. This can become a crutch for your staff that end up trying to avoid entering clinical notes at the time of the patient visit. You know, it feels like everybody is chartless these days, but when you are jam-packed and running like crazy, you do need a backup plan to get the correct treatment charged out and have the patient definitely pay their portion. Here are a few ideas to help you keep up. The first is the dentist tells the team that the expectation is that all the charges and the clinical notes should be entered before the patient gets up from the chair. The next is set up a backup plan for when you run behind. You know, for example, have a blank route slip form in each treatment room and then circle the procedures that you completed today and note the treatment plan for the future plus the time needed. Then walk your patient up to the front desk, hand the form to your administrative assistant, let her enter the treatment, get the treatment plan for the next visit, and get paid. Now you go, hustle back and get caught up. The last idea is have your office manager just keep track of your team's success. You know, often there is one staff member that just seems to never have the time to enter her clinical notes. You know, if the office manager saves the route slips, then the dentist can see which staff are not entering notes in a timely manner. Then the dentist can actually sit down and talk with that staff person to figure out how are they going to figure out working in clinical notes into their day. You know, entering charges and clinical notes while the patient is still in the chair, it's obviously the best way to go, but having a backup plan for busy times, it just makes sense.